So, hello and namaste to everyone. This is Name-Shalu Singh from Department of Physiotherapy and Diagnostics from Jayoti Vidyapeeth Women's University. So, in our last section, I discussed about your urine collection and its storage. So, for today's section, I'll be having focus on physical examination and chemical examination of urine. That is basically a result and interpretation part. So, urine is basically your sterile liquid, and it is the byproduct for which is secreted by your kidneys and through the process of your urination, and it is excreted through your urethra, and for estimation of various biomolecules and various components which are present in urine analysis is done, which is like analysis of urine. So doctor will prescribe you with a routine and microscopy of urine. So it is an array of tests which are performed on urine, and it is one of the most common methods of medical diagnosis. So there are various type of sample which are collected. And one of the most common samples which are collected are your early morning sample, your midstream collection of urine, and your 24-hour sample collection. So many more are there, but these three are the most common and most basic. And also for storage of urine, you have to take care. Like if your lab is far away from your collection point, so you have to store your urine sample. So under 4 degrees Celsius temperature, so that biomolecules they don't get broken down, or so that they don't affect your interpretation or your results. So let us come back to our today's topic, which is physical examination. So physical examination and your chemical examination. So physical examination is basically what? All those examinations for which you don't have to you don't need any machine or any chemical or anything. By just looking or smelling with all your senses, you can test those samples. So urine color, we can first of all we can check in physical examination is the color. So urine color is basically an indicator of hydration, and urine pH is often influenced by a diet. So because if you have some higher amount of protein diet, so you may get acidic urine. So, and urine smell, it indicates the age of the urine, and it may indicate your presence of glucose or ketone. Okay. So in presence of ketone bodies, fruity smell of urine can be observed. So, and urine turbidity, it may indicate urinary tract infection or a obstruction. And urine analysis basically is the process of analyzing and detecting your chemicals which are excreted in urine. So, when I say that there there is a urinalysis, so urinalysis is basically the process of analyzing and detecting chemicals that are excreted in your urine. Now, the various physical characteristics of urine include your color, smell, your pH, your density, and your turbidity. So, physical characteristics, let's talk about the physical characteristics. So, physical characteristics can be applied to urine color, turbidity, means transparency or opaque look of your urine, your smell, which is your odor, and pH, acidity, or alkalinity, density. So many of these characteristics are notably identified by vision itself. So, but some of them require your laboratory testing. So, let's talk about color. So, typically, the color of your urine is amber color, but it varies according to your recent diet and the concentration of urine. So, drinking more water will generally tend to uh, reduce the concentration of urine, and therefore it will cause it to have lighter color. And dark color of urine may indicate your dehydration. So, red urine will indicate red blood cells within the urine. So, kidney sign of kidney damage, and it will signify the sign of your kidney damage or any disease. Now, the color, so you can say, okay, whether if it's red or pale or yellow, so you can identify what is there. So, smell also is one of the factors through which you can identify if there is any pathology. So, smell of urine may provide health information, like for example, urine of diabetics, they may have sweet or fruity odor due to the presence of ketone, and organic molecules of particular structure or glucose. So, generally, fresh urine has a mild smell, but aged urine has stronger odor and similar to that of your ammonia. So, now, apart from your smell, pH plays a role. So, pH of normal urine is generally in ranges from your 4.6 to 8. So, with a typical average be 6, average pH will be your 6.0. So, much of the variation occurs due to diet. So, for example, if a person has consumed high protein diet, so it will result in more acidic urine. But in vegetarian diets, these are mostly alkaline urine. So both within the typical range of 4.6 to 8. So next parameter is your density. So density is also known as specific gravity. So it is the ratio of weight of a weight to the volume of a substance, and it is compared with the weight of the same volume of distilled water. So normal density of urine, it ranges from your 0.001 to 0.035. Now, next part, if I say, is your turbidity. So, turbidity of the urine sample is got subjectively, and it is reported as your clear and slightly cloudy, and cloudy, or we can say, or opaque or fluorescent, and normal and fresh urine is either clear or very slightly cloudy. So excess turbidity will result from presence of suspended particles in urine. So cause of which it can be usually be determined by the results of your microscopic urine sediment examination. So common causes of abnormal turbidity will include increased cells, urinary tract infections, or your obstructions. So abnormalities in any of these physical characteristics, they may indicate disease or your metabolic imbalances. So these problems, they may be superficial or minor or their own. So, but they can actually be the symptoms for more serious disease such as your diabetes mellitus and your damaged glomerulus. Now, let's further telling you about various interpretations and observations in case of physical examination of urine. So in under naked eye appearance, so first of all, as I've already told, that urochrome, which is the chief pigment, and it is responsible for your amber color of your normal urine. So in addition to normal urine, it contains traces of your urobilin and other pigments. And urobilinogen, which is colorless, it is also contained in traces amount. And there is, irrespective of pathological conditions, urine may be pale and owing to intake of large volumes of fluid, or deeper in color, more orange, and owing to copious sweating or to reduction of fluid intake that is concentrated. So red color of urine will indicate blood, hemoglobin, myoglobin, or beads. Port wine color will indicate the presence of porphyrin. Your brownish black color will indicate the presence of melanin or oxidation of melanogen. It may also indicate alkaptonuria, so oxidation of homogenetic acid. So brown color will indicate your presence of bilirubin and methemoglobin, and orange color will indicate small amount of bilirubin. So greenish color will indicate biliverdin, that is oxidation product of bilirubin. And further, deep yellow color, that is riboflavin, tetracycline, antibiotics, and certain chemotherapeutics. And white color is indication of chyluria. So under naked eye appearances, it will be noted also whether urine is clear or cloudy. So whether there is any deposit visible. As a rule, phosphates are deposited when urine is alkaline, and urates or uric acid, so when it is acidic. So brownish urates may be then dissolved in your KOH, phosphates in acetic acid, and these deposits, they are mentioned in a cooled specimen and are in most cases of no significance. So on the other hand, turbidity, it is caused by massive occurrence of white blood cells, your microorganisms, which is always pathological. So secondly, your odor, which is a characteristic of first of all, ammonia, which is due to decomposition of bacteria and increase in pH, or unpleasant odor of phenyl acetic acid is phenylketonuria. Volume, which is output range from 1.5 liters per day, and oliguria is said to be present when the urine amount is less than 400 ml per day, and anuria is less than 100 ml per day. So when the urine output, it exceeds 2.5 liter per day, polyuria is present. So for a density of urine, the specific gravity may be taken with the help of your urinometer. So there are various other chemical examinations. So strip test is done in order to detect the chemical present in your urine. So for various strip tests, you can always do it for your proteins, your glucose, your ketone bodies, your blood hemoglobin, your bilirubin, and your urobilinogen, and these different parameters, they can be detected. So what you have to basically do is take that urine strip. So that urinometer strip, you have to dip it in your urine sample, leave it, then take it out and leave it aside for 1 to 2 minutes. So within a very brief period of time of 1 to 2 minutes, it will show some color. Now this color you can match with the bottle, and that acid bottle will show different variations of colors. So you can match that color with the color on your bottle, and with that color matching, you can detect what sort of component or what parameter is present in your urine. And also there are strips in which you can also slightly quantify also the amount of your parameter, that is your amount of component that is present in your sample. So different color will indicate different amount of your different samples. So urine strip test can be done, which is a regular day-to-day test for the urine estimation. Other are your chemical tests. So different chemicals are used for the analysis of urine. So for proteins, like there can be done sulfosylsilic acid test, or Heller's test, or heat coagulation test, which is most basic and most important. Heat coagulation test is done. For glucose, Benedict's test is done, which is the most basic test. So for other tests, there can be Felling's test or Nylander's test. And for ketone bodies, so there can be Lestrada's test or Legal's test. And for blood and hemoglobin, there is Heath-Boyer's test. For bilirubin, there is Norman's test, or Hammerstein's test, or Gramelin's test, or Rosen's test. And for case of urobilinogen, there is Ehrlich's aldehyde test. So these are the chemical tests which can be done. So it basically requires some set of chemicals. So, but more basically, if I talk, strip test is done for the urine analysis. So this was all for the physical examination of urine. So in further sections, I'll talk about chemical examination of urine. And until then, if you have any doubts about the present topic, you can contact me. And until then, thank you and take care.